start by me doing a bit of housekeeping about the reorganisation that's happened in the democratic services. We've now got Joe looking after us instead of Laura, who has gone off to look after some other committees. So official welcome, Joe. Nice to see you.
Thank you very much. We're all here. We're all still in democratic services, but we've just had a little bit of a rearrangement about which committees we will be servicing. So I will be taking forward this committee from this meeting. Thank you.
Thank you. We're all muted ourselves. If you wish to speak, would you please wave your hand about in a frantic manner so that we know you want to contribute to the meeting? And then Joe's on the lookout for frantic wave-ins, and she'll tell me who in fact wants to speak. Thank you. First of all, we have apologies for absence. Do we have any apologies for absence?
We've no apologies for absence. I can see, I think Councillor Sean Parsons hasn't joined the meeting at the moment, but I haven't had any official formal apologies for absence. Cathy Williams, Cabinet Member, would have liked to attend the meeting but is unable to do so. And the representative from Health Watch Gloucestershire, Patty Compton, is also unable to attend the meeting.
Okay, thank you. And we now come on to minutes of the meeting that we held, goodness me, on the 7th of July. Has anybody got any matters they wish to raise on those minutes? Or otherwise, can we agree that they are a true and correct record? Anybody wants to wave? Councillor Gravels wants to have a few words. Andrew.
I thought you were asking for them to be approved as a true record. Sorry, that's the only reason I was waving to.
Okay. Well, we do seem to have nobody who wants to say any words about the minutes. So can we approve them as a true and accurate record of the meeting? Could you put your hands up, please, in a formal fashion? Okay, thank you very much. They're approved. And we now come on to declarations of interest. Has any member got any declarations of interest they want to express over and above that which they have already formally declared? No, that's fine, thank you. We now come on to the meat of the meeting, and let's go to number 4, COVID-19 testing in care homes. I'm told that this is going to be a duet. I don't know whether it'll be a simultaneous duet between Margaret and Sarah. So who's going to sing the first few lines?
Those are mine. I won't sing them to you, although I don't have a bad voice. And I have sung first soprano in the Berlin Philharmonic Hall, but that was a long time ago. Okay, so from our point of view in social care, the 2 first parts of the report are about the infection prevention control grant, which we were given by government. And that's money that has gone to every provider in the county, regardless of whether we commission with them or not. So that's all care homes, all domiciliary care. And we decided that in the second tranche of it, we would also extend that to all supported living schemes. So everybody's had a fair amount of cash to help them with their infection control. The shortfall in it is that the 75% that went to care homes, the national guidance was that they couldn't spend it on PPE, which we've said back to government, which is a bit unfortunate, really, because that's actually what most people wanted to spend it on. What they have been able to do is substitute it. So if they've arranged a visiting room, for instance, or changed the signage or cohorted staff on a wing, they can substitute the cost of that for this grant. The 25% had more flexibility, and that has been used by providers for PPE and quite creatively for other things. We've got 2 lots left.
Someone has a mad dog.
Sorry, it's my pair. I'll shut them out. Go on, out. Out.
Just to say, it's Tim Harmony. Sorry for delay in coming. I had a technical issue, but I'm here.
We've had them as well, Tim. Join the club. Good morning. Right, Margaret.
There's still lots of money left. So there's about just shy of 400,000 left that we're going to use to vaccinate care home staff across the county if we don't get any national funding for that, because we've been instructed to make sure that we vaccinate as near to 100% of staff as possible, which for us would be about 4,000 people, but we haven't actually got any money to do it. We don't know if the national scheme, well, we know that the national scheme applies, but the problem with the national scheme is you have to go somewhere to be vaccinated. And we know from history that many care workers won't do that because they have to go in their own time. They have to go to a supermarket or a GP, and it's all too much effort. Where when we go into a home and vaccinate people, we get a much better result. So we are exploring the idea of using it for that. And then we've got another 400,000 left that people haven't claimed. And we are going to distribute that to carers, care providers again. So they'll get a third amount, which will be small in comparison to what they had before, but nevertheless a significant amount of money in total. And then the other issue is about testing in care homes, which the second part of the report goes on to describe what we did when, as people were discharged from hospital, sticking to the national guidance and changing it as it happened, so that we, together with the CCG paid to buy isolation beds so that people had a 14-day quarantine period in 4 different locations across the county. And we've continued to use those, but the demand obviously has subsided. We are beginning to see some repeat testing showing, and I'm sure Sarah will come on to this in more detail because she's the expert, but we are beginning to see some repeat testing showing particularly staff having more than one positive test. And again, it's difficult to know whether that is the original infection staying in place, whether it's what's referred to as the long tail of the virus, because apparently it lasts for quite a long period for some people, or whether it is a refresh or a new infection. And that's probably the point at which I hand over to Sarah and she picks it up. But we're happy to have any questions. It is a very long report, and I don't apologise for it being a long report because I think it's been quite a comprehensive one. I hope so, anyway.
It is indeed. Thank you, Margaret. Sarah.
I just thought that Ian had a question. I'm conscious it's quite a long report. Maybe it might be easier for questions for Margaret now, Chair, and I can then cover the rest of the report if that's acceptable.
Can we just revert to, does anyone have any questions for Margaret?
I can see Ian waving.
Ian's waving, thank you.
Okay, actually I had 2 questions for Margaret, please. Firstly, in the summer, the government promised a universal programme of continued repeating testing in care homes by yesterday, the 7th of September. Was this comprehensive target met in Gloucestershire? And secondly, it was reported in the media that in Gloucestershire, more than 100 patients were discharged from hospitals to care homes without being tested for COVID-19. Do you accept this figure as accurate?
I don't know the answer to the second one. It looks like Sarah does.
The answer to the first one, I think, about the care home testing, I was going to cover in my report. Ian, so is that okay if I cover it further on?
Okay.
And then the second one's probably for Margaret.
I couldn't tell you, Ian, whether the figure of 100 is accurate or not, because that's the first time I've heard it. But I will go and find out how many people went. If you recall, the very early on discharges to care homes did not come with testing because there wasn't a national requirement to do so. But that was only for a matter of weeks. And then we followed the guidance and everybody has been tested since. But I don't recognise the figure of 100, but I'll ask Brenda Yearwood for some detail on that.
Thank you.
Anyone else want to ask Margaret a question? Thank you, Steve. Steve?
Thank you, Chair. Margaret, you mentioned about money going to supported living. So was that dealt out to district councils, etc.? To deal out?
No, it went straight to the provider. So there's a difference between supported living and supported housing, which I think is probably what you're thinking about. So these are schemes where people live in small groups and share care, and the government hasn't allocated any money to that cohort. But we have a lot of those schemes in Gloucestershire, particularly for people with learning disabilities. And we took a decision with our politicians' agreement, Carol and Kathy, that we would share the money to those individuals as well, because actually they've done a tremendous job of keeping people safe throughout this pandemic. And the numbers of people with learning disabilities with COVID positive tests in Gloucestershire has been remarkably low, unlike many other parts of the country where they were remarkably high, I would suggest.
Yeah, thank you. I was getting mixed up there. Yeah, thank you.
No more questions, members? Jeremy?
Yeah, I'm going to the section. Can you hear me okay?
Yeah, fine.
Yeah, it's been breaking up all morning. I'm getting rather fed up with these online meetings. They're constantly breaking up, usually when I'm just about to speak. Care home.
It's not a plot, really, honestly. It's not a plot.
I don't believe it. Care home look back. A process for a look back on COVID-19 cases, outbreaks and mortality in Gloucestershire homes to date has been developed. The aim is to learn from what happened during the initial period of the COVID-19 pandemic in order to make any appropriate changes which could facilitate better outcomes if there is a resurgence of COVID-19 cases in the coming months. I wonder who's going to be carrying out that look back and study, and when is that study going to report? How independent is it? I mean, I remember pressing officers right at the beginning, raising concerns about the discharge of patients from hospital into care homes and the fact that people weren't being tested. And it took a few weeks to resolve it. And I know you keep using the excuse, it was national guidance, but I was warning you about the problem and nobody took any action. And I'm surprised, because if I'd been the cabinet member, I'd have said, no, we stop this. And we make sure that we protect our care homes and make sure they're locked down until the NHS actually gets round to testing these people. So, it's all right following national guidance, but when you know that something's going wrong, you stop and show some independence. And I just wonder why that didn't happen. So I just wonder when this care home look back study is going to happen and who's actually carrying it out. Who is the officer? The name.
So Jeremy, if your reception's breaking up, sometimes it's helpful to turn off your video. It can secure the audio line a bit better for you. So I'll go on to present the rest of the report now. So to Jeremy, you slightly beat me to it. So the care home look back is an opportunity, I think, for us to reflect on what we've done, how we've done it, but to understand what worked and didn't work from a care home perspective as well. So it'll be largely carried out by my team, working closely with Integrated Brokerage, because they've been the support to the care sector throughout COVID, and also working with the CCG's patient safety team as well, under the executive nurse Marion Andrews-Evans. I think what I would say about the discharges to care homes, at the very beginning, the testing capacity was extremely limited, and it was very tightly controlled, and we were given very clear directions as to who could and couldn't be tested. So when Margaret has said that we followed national guidance, we followed national guidance because there was a lack of testing capacity. Now, we could talk for a long time about whether that's right or wrong, but that's what happened at the beginning. So I think that's one of the reasons why we are where we are with care homes. Also, I think it was a new disease. We didn't know it existed until the very beginning of this year. And we didn't know the disproportionate effect it would have on the older and frail population. So we have seen a disproportionate impact on the older age bracket, as a lot of the evidence now clearly suggests. So I completely accept that lots of lessons will be learned. The care home look back is to understand, well, what could we do in terms of, so for example, we rolled out a programme very, very quickly with the CCG for training around PPE. So would it be helpful to run that more frequently? What other support would care homes need? Because I think it's very easy to sit centrally with a region or locally and decide what the care sector need, but we actually want to understand from the care sector what would help them manage in a second wave, as well as understanding some of the data. We might have done a lot of work on the data to try and understand the patterns, and we've shared those whenever we can. So that's the premise behind it, just to try and understand what happened and inform our work for the winter. So if everyone's happy, I'll carry on down the rest of the
Yes, please.
report. Okay, so this just gives an update on other pieces of work we've done, and I think the reason why it's a joint report between Margaret and myself is that our teams have worked incredibly closely. So in July we had new guidance around visiting to care homes, and we don't underestimate the impact of the ban on visiting and the impact that's had on residents of care homes and their relatives. So we produced a whole suite of guidance that then was shared across the South West as best practice to enable care homes to undertake a risk assessment to determine whether to allow face-to-face visiting or not. I was also asked, as were all directors of public health, to come up with a position in terms of whether care home visiting should take place or not. So we make a recommendation. We've developed this guidance in association with the Gloucestershire Care Providers Association, and they've been really supportive of this approach. So at the moment, from my perspective as Director of Public Health, care home visiting can happen, can take place, and we've given lots of guidance as to how to do this in a safe way. But ultimately, it's up to the care home as to whether that happens or not. So there are some links in the report then to the guidance on our website. We were also asked about residents leaving care homes for visits or holidays. So quite often families might take relatives away for a short holiday, they might take them out for Sunday lunch, that sort of thing. And of course, we've worked quite hard to try and protect the people in our care homes in various forms of COVID-free bubbles where we can around this vulnerable population. So if they're going to be taken out for visiting, for lunches, for holidays, that of course then causes a potential risk to the other members of the care setting. So we've produced some guidance, and at the moment that's with the Care Providers Association. Again, trying to really carefully balance the needs of the individual, their physical and mental well-being, and the physical and mental well-being of the relatives as well, and the infection risk. So, so that's currently with the Care Providers Association for comment. We have produced some guidance, we actually produced it in advance of the national guidance for opening daycare centres, again for the same reason. We provide daycare facilities for a range of different people, and again it's about balancing the need for their need for social interaction and to access to day centre support versus the infection risk. So that guidance is out there. I'll just touch on testing. So as you'll know, there are two types of tests. There's the antigen test, which basically tests if you've got COVID now. And there's an antibody test, which tests if you've had it. From my perspective as a Director of Public Health, I'm far more interested in the antigen test because it tells me how the disease is circulating in our population. So the report gives you an overview of antigen testing in care homes. And it talks about the rollout of a programme to test care home staff every week and care home residents every 28 days. It talks about pillar 2 testing. And testing for COVID has a number of different pillars. So pillar 1 is the NHS testing stream. Pillar 2 is the testing that's been commissioned from the private sector. So the testing you get through Hempstead Meadows, Regional Testing Centre, or the postal test kits you can access, or the mobile testing units that move around the county. Pillar 3 is the antibody testing work stream. So care homes are tested routinely via pillar 2, and the report talks about certain dates, and Ian's already asked the question about the rollout to all care homes, older people and dementia by yesterday. That was all going pretty well until a couple of weeks ago, there were issues with capacity in the pillar 2 testing work stream. This has been widely reported in the media, and thankfully our numbers of cases in Gloucestershire are still relatively low compared to other parts of the country. So there's not a shortage of testing capacity in terms of people to take the swabs. There's not a shortage of swabs. There's a shortage of capacity in laboratories to process the swabs. So what they've done is they have, the Department of Health and Social Care have prioritised where the testing capacity should go. So we still have testing capacity in Gloucestershire. We get around 750 tests, I think, done a day. That's across the care
target
homes.
won't be met. But the target won't be met, will it?
I don't know, Ian. I mean, that's the point. I don't know because of the lack of testing capacity. So this is a national issue. It's an issue that's affecting us. It's completely and utterly beyond my control. I have no ability to influence where the military testing capacity goes. I'm just saying that we do have some military testing capacity, so care homes will still be being tested, but I can't guarantee it the volume to meet the deadline of yesterday in whilst writing the letter. Margaret.
Just to add, stating the obvious probably, but where there are outbreaks, the testing has been diverted to those areas. So some of the availability of testing has simply been that it's needed somewhere else. So in the southwest, obviously Swindon, there's a growing area in the tourist areas, Greater Manchester, Oldham, Leicester. So those places have dominated the capacity for testing.
Thank you, Margaret.
Okay. So I'll move on then. So the antibody testing is the other type of testing, and this is another national programme being rolled out to care homes. And we think just over 30% of our care homes have taken up this offer. And so we're working with our care homes to promote it. I think that what I would say about antibody testing, it has no clinical benefit. It just tells you whether you've had it or not. And actually what we're now learning about COVID is that you retain your immunity for a relatively short period of time, hence the need for a vaccine. So whilst it's been rolled out, it rolled out initially to the health sector and now to the care homes. So we are supporting care homes to do that, but it does involve a blood test. So either the care homes have to take the blood or send the staff somewhere where they can have a blood test. So just moving on quickly, we report here finally about the prevalence of COVID in domiciliary care staff. There was some concern throughout the beginning of the pandemic that dom care staff were probably going to have a similar prevalence of COVID-19 to those in care homes or in the health sector. And a study was published that showed actually they didn't really have their levels of COVID weren't really any different to the general population, which is really pleasing, I think reassuring for those that have relatives looked after by dom care workers. And it's part of this study, although it does have some limitations, which are noted in the report, that was central to the decision to not introduce regular routine testing for domiciliary care workers. So I'll pause there, as I recognise there's quite a lot of information.
Does anybody have any questions or comments to make?
Ian, I've not confirmed that. I've said I don't know. Your statement there is incorrect, just for the record. I said okay. I don't know whether the target's been met.
Okay, well, I have a question for you, Sarah. You've got a supplementary COVID-19 update, which shows, are we going to talk about that now, or are we going to talk about that later?
I was just pausing for questions I've just covered quite a lot, and then I was going to go on to the COVID-19 update.
Okay, I have a question when you can do that. Thank you.
Can I just add that not to underestimate the number of complaints we've had from the population as a whole, often through MPs, about the restricted visiting in care homes. People are openly writing to me to say, I'd rather my parents died of COVID, but I saw them, than to keep them isolated, because they don't see it as keeping people safe. They're seriously worried about the loneliness and isolation, and we've had some quite disturbing incidents with residents who don't understand why they haven't seen their family and are getting very distressed about it. So I've had another MP's letter just this morning saying, why can't we be tested as visitors the same way as staff are in order to let us in? But unfortunately, that's not available to people unless they've got symptoms in the current climate. So I think it is getting quite tense in parts because some people haven't seen their relatives now since the middle of March.
Yes, yeah.
And from our perspective, visiting can go ahead. It's a decision on behalf of the homes. So we've made our decision really clear. We've used the Gloucester Care Providers Association to push out my advice based on, and it's details in the report, how we come up come to that conclusion. And we review the cases each week, we review the distribution of the cases. So from our perspective, visiting can continue, or can restart, sorry, but it's up to the care homes to make that decision.
Thank you, Sarah.
Yeah, and some care homes have decided not to, quite a number of them in the Cotswolds in particular have said that they won't accept visitors at the moment for a number of reasons. Partly, you know, they may have had tests, positive tests amongst residents or staff, or at least a couple of homes I can think of have had no positive tests at all and they want to keep it that way. They've enabled other ways of doing it through iPads, you know, people meeting in the garden, all of those sorts of things, but it still isn't what people want, unfortunately. It's a difficult balance for them, I think.
And it's quite an understandable situation, isn't it? Anybody else want to make a comment? Brian?
Thank you. First of all, I myself am very sympathetic to the people in care homes if they're not able to visit. I think, you know, recognising that people go into care homes at the last stage of their life for a relatively short period, it must be very difficult for the people in the care homes and for their families. So whilst I can see that it's a decision for the care home operators, I would have thought there was a case for working very closely to make sure that, particularly in individual cases, an appropriate solution is found. But my question really was on the point that Margaret raised, which I thought Sarah was going to come on to, but she hasn't, so maybe I'm asking too soon. But it was that point she said was that care home staff have been tested positive on more than one occasion. So that suggests either that people can catch the virus or a different version of the virus if it's mutated more than once, or that they might actually have it for longer. And that seemed to be a bit of a sort of game changer to me, because if in fact the virus lingers for much longer and can remain infectious, surely that sort of puts into question our sort of process of quarantining for a period of 10 days, because it may not be long enough. And also it suggests that any prospect of getting sort of herd immunity may be a little bit sort of hopeful. So I hadn't heard that before, so I just wondered if Sarah could actually expand on what she knows about the likelihood of catching it twice.
Willing and able to.
So I've not heard that care home staff were catching it more than once either in Gloucestershire. I've heard of it happening. The issue, as Margaret quite rightly said, was that so either someone could, most commonly it's because you've retained some of the virus. Your viral load has not gone completely. And it really relates to the period in which you're infectious, because you might carry COVID for quite a long time, but you might not be infectious. So they've changed the self-isolation period, haven't they, from 7 days to 10 days based on the understanding of the virus. But there's nothing to suggest that we've had some people that have tested nationally positive for up to 6 weeks, but they don't believe they're actually excreting the virus. And because there isn't actually a cure, we can't eliminate the virus. It's quite difficult then to know what to do with that person. So we're following the guidance nationally that's based on the advice of SAGE, and that's all we can do really. I think it might be possible that you can catch it more than once. I don't think there's any evidence of the virus is mutating. But this is why we've got the programme of regular testing of care home staff, because they're the ones that are out and about and potentially bringing the virus into the care home.
Thank you. Are you waving again, Brian? No, he's cleaning his lens.
I have to do that to switch the microphone on and off, so it just looks like I'm waving.
All right.
I think Councillor Hilton wanted to speak.
Jeremy, yes, thank you.
Yeah, Sarah mentioned and seemed to indicate that people with antibodies and probably T cells that have dealt with COVID-19 on the first infection could be susceptible to getting it again. But there's no evidence of this unless you can provide it, then she shouldn't say it. There's 20 million cases around the world and loads of people have survived COVID-19. There is just one case that I know of that I read about of a guy from Hong Kong that had it in Hong Kong, then came to Europe and picked up a slightly different strain and showed no symptoms whatsoever. So his antibodies and his defense system was working, but they picked up when he came back into Hong Kong airport and tested for slightly different virus, the mutation. So, you know, the issue is that almost all those people that probably had COVID-19 will probably have a great deal of immunity, and probably, if they do pick up a different strain, won't even notice it. So I do think, you know, the Director of Public Health shouldn't be making statements about the likelihood of people getting it again unless she has scientific evidence to prove that's the case. It's just supposition at the moment, because with all, 20 million cases, there's no evidence of people getting COVID-19 again. No evidence. And we shouldn't be propagating myths, which is what Sarah Scott's just done.
But I think there is evidence, Jeremy, of getting it again without any symptoms. They're not.
It might not be getting it again. It just might be the test system that's picking up the residue of the virus rather than people getting it again.
Okay, no, that unless Sarah wants to say anything. No, okay, thank you. Are we all finished with questions?
Would you like me to go through the COVID dashboard?
Yes, please.
I'll do that quickly. Okay.
This, which we got yesterday.
Okay, so we are still working to develop the formal COVID dashboard. So this is the data that we make publicly available to a variety of different committees. You'll see on the paper, first of all, so this is the data as of the week before bank holiday. The data's changed slightly. The data changes every day. So if we produce something yesterday, it would be out of date today. We've had a total of 2,054 positive cases in the county, and this particular week, the cases went up to 47. It's our highest week for quite some time, and you can see there the spread across the county. We are seeing increasing cases in Cheltenham and Gloucester. And that particular week, we recorded 2 deaths where COVID had been noted on the death certificate. Last week, we saw 33 cases of COVID, but we suspect that what will happen is as because of the delay in lab capacity, that number will almost certainly increase as we head towards the middle of this week. So we're seeing a slight upturn in cases, as you can see on the chart on the bottom of the first slide. This is concerning, clearly, because we've had a bulk of the summer with very low numbers of cases. It's in line with national trends. We've done a couple of deep dives. Each week we do a deep dive into the number of cases to understand, are there any, we would be informed of outbreaks, but are there any common factors? So common, the ethnic groups the same, and the postcodes, the geographical location the same. Are we seeing patterns across age groups? And we have seen certainly an increase in cases in those aged between 18 and 30. And we're working very closely with our Commons colleagues to try and understand what we can do in terms of more nuanced messages for this particular age group. So the second slide talks about infections. So as I've said, the week 35, which is the 24th of August to 30th of August, is now standing at 46, and last week, week 36, is currently at 33, but we're expecting that to increase. And that's partly because there's a delay in informing us of the lab result. The third slide covers mortality. I think I've probably talked about this before, whereby we show non-COVID deaths and COVID deaths. And a COVID death is any death where it's got COVID mentioned on the death certificate, either as primary cause of death or a subsequent cause of death. The black line is the decimal causes in this year, and we include that because it's a way of capturing any other deaths that might not be included in the COVID-19 deaths, the blue bars. And then the dashed black line is the decimal causes, the 5-year average. So what you can see at the moment is our number of deaths is actually below our 5-year average. So thankfully, we've got past the peak from April and May, and we're now seeing a slight reduction on what we would normally expect to see. Clearly, this is really, really pleasing. As we go further into the pandemic, the government is producing a much wider range of data. So what you've got here is data produced for the medium super output areas. We have 75 of these across Gloucestershire. They're slightly bigger than a ward, but smaller than a county council division. So this data is freely available on the government website on the coronavirus portal. They've started in, I think in last week, they're producing the data at lower super output area, which is a much smaller geographical area. So in this particular week, we had 2 areas that had more than 3 cases, but this was not an outbreak. And sometimes we're just seeing clusters of cases. We might see a couple of cases in a household, for example. So whilst we looked into this, this was not a cause for concern. And you can see the outbreaks across the rest of the country when you go and look at this online as well. And lastly, we've included the R value. At one point in the pandemic, the government were relying on this quite heavily. I think we've certainly moved away from that now and using a much broader range of data to understand the impact on the population. So you can see the Southwest R value sits somewhere between 0.9 and 1.1, but I think it's worth saying that we have very low numbers of cases in the Southwest, so it does sort of insert a degree of uncertainty around the value of the R and how much we can attribute it to how much we can use it sort of to inform our policy decisions. So it's not something we genuinely refer to at the moment. We keep an eye on it, but we spend a lot more time looking in detail at each case and the any potential links to other cases and common factors where we might be able to push out some messages to prevent further cases. So I'll pause there. Happy to take any questions.
Councillor Hilton.
I think I was first, wasn't I?
Sorry,
I'm first. I'll let me in.
Come on.
The issue on the sort of growth or the number of infections in Gloucestershire and in the southwest, I'd be very interested to see how that's panning out compared to that in our neighbours in Wales, where the regulations on the wearing of masks is different from what it is in England, and whether there's any difference in the infection rates that they're getting in Wales compared to England, particularly the southwest of England, which is probably demographically very similar to Wales and fairly rural area. Have we got those figures? Because I'd be very interested over the weeks to see whether that particular public health measure we have in England is actually making any difference.
So I don't have any access to that data at all. I only have what's publicly available. So I wouldn't be able to ask the team to do any in-depth analysis on that. We can only look at the published data.
Okay.
As somebody who's currently living in South West Wales, I can tell you what's publicly available, and that is that because Wales had a much stricter restrictions from the beginning, where we were only allowed to travel for a mile for 12 weeks and then 5 miles for the following 6 weeks, and then the lockdown was lifted for travel 6 weeks ago, maybe 7. The incidence has been extremely low, and in Ceredigion, for instance, they haven't had a single COVID case in the whole of the county. So, but people are much more respectful of the rules. We're not having the sorts of problems that we're seeing, particularly amongst the younger generation, where people are gathering. That's with the exception of the festival that happened in the forest, not the Forest of Dean, but the Welsh Forest. But there's no mask wearing. There's no requirement. A lot of people are wearing masks, but that still people aren't visiting each other's homes and stuff. It's quite different, and it's been very strongly policed. In the first 3 or 4 months of lockdown, every time I went out, which was only once a week, I was stopped by the police because my car registration is for Shropshire, and they assumed that I shouldn't have been there, and so I had to kind of carry my council tax papers. So the whole attitude to it has been quite different, I would say, from personal experience.
Thank you. Ian.
The map of cases by lower tier LA shows the area of Gloucestershire with the highest level of COVID-19 infection is South Cheltenham, including the area which I represent. Now, this is the first I knew about it. So please could councillors, both county and district, be proactively notified when their area, division or ward enters the red zone, or in this case, the blue zone, for higher levels of infection?
See, we do prepare regular updates. I think there's a balance to be struck between the capacity in my team to analyse the data to inform action to prevent onward infection and passing on information for information's sake. Now, I'm happy to have a conversation about what members want to see. We have a members and engagement board where we pass out quite a lot of information to a range of elected members. This information is freely publicly available on the .gov portal, coronavirus pages. So I think we probably need to have a think about how best to use my team's capacity. So we have, we look at the data every day. We look at the number of cases and we look at the number of situations. So cases that have happened either in a school or a care home or an employer. And then what we have is a cascade notification system based on a risk assessment. So for example, a case that lives, it doesn't work in a care home or a nursery or a hospital or a school, just perhaps would be an office worker who's working from home, would be rated as a low risk case, and that would just be sent to me for information. Anything that is medium to low risk then goes to the leader of the council, the chief exec, the relevant director, and the relevant cabinet member. As we go up that risk assessment process, the local members will be informed. So if there was a particularly difficult outbreak or something in your division, we would be telling you. But if we haven't told you, that indicates that that case is low risk. And I think we need to balance the capacity I've got in my team to investigate the outbreaks and to take remedial action with PHE versus informing people of someone who happens to be an office worker who lives in a house and doesn't really pose that much of a threat to the public's health.
So can I come back on that? So you're saying you make a judgment call as to whether it's 10 cases or whether it's 40 plus cases, and it's a judgment call at which level you proactively inform the district and county councillors. So you're deciding at what level the county and district councillors need to be alerted proactively, because I think it's really important that we as representatives of our community are the first to know. And I'd also like to know what your judgment is based on. At what level do you trigger in informing the local councillors so that they know what's going on in their division or ward?
So as I've just said, we have a process. We have a robust risk assessment process. We use the same risk assessment as Public Health England. So I'm not suggesting I'd sit on 40 cases and wouldn't tell you, Ian. What I'm saying is it depends on the level of risk associated with a single case. So if, for example, you can have one case in a particularly high risk scenario, and we will be telling a local councillor. So it's not necessarily dependent on the number, it's the risk associated with the situation, because you could have 4 cases in a household. You can have an unfortunate situation where a family all have COVID, they're self-isolating, they're low risk, the health protection team in Public Health England are satisfied that they're going to abide by the isolation rules. They would be deemed to be low risk. We wouldn't tell people or mark that because we think it's low risk. They're going to be containing themselves. I mean, we're dealing with 40 cases a week. So, sorry, my phone's just ringing.
Okay, so I do get that, Sarah. I can see you have to apply common sense, but I'd like to know what the algorithm is that you're using.
We can share that. I can bring that to the next scrutiny committee if you want. I think sending it out on its own probably would help in a limited way. But if members want to see it to understand how we're prioritising, I don't have a problem sharing it with the committee at all.
Thank you.
But there is a robust process behind it, and yes, it is down to our judgment. But my consultants and I spent 5 years training to be consultants, so we are well qualified to make these judgments. And there is a fail-safe applied to that, so all the work is checked by a qualified consultant. So I am assured that we have a robust process in place.
I'm sure you know best, Sarah.
I'm happy to share the cascade with you.
Thank you.
Thank you, Sarah. Thank you, Ian. Any more questions, members, and comments? Could I just make a comment? We've got lots and lots of information of what's happened in the past. Currently, it's obvious that there's a bit of a takeoff in the number of new infections. Are we using what we've learned in the past to tackle a future spike in the number of cases of COVID-19, which seems to be bound to happen?
So I can start and Margaret can kick off. So I think we're involved in lots of sort of look back exercises or opportunities to gather our learning. So we're doing a look back as a corporate leadership team in the County Council to understand how our to reflect on our approach and what we could have learned from it and how we can apply that in any second wave or outbreak. We've got the look back exercise for care homes. I'm regularly, if not every couple of days, receiving emails from areas that had outbreaks, Swindon, Leicestershire, Greater Manchester, sharing their learning in terms of what's worked going forward. So we have in the document I was just talking to Ian about, we have amended that several times based on the learning from other places. So I think there are plenty of opportunities to learn and to incorporate that into our response. Margaret and I are also taking part in the look back exercise for the local NHS system to help them with our perspective in terms of how they could improve their or what worked well, I suppose, at this time and what could be improved next time. So it's happening at multiple levels, I would suggest. Margaret, I don't think you've got anything to add to that.
No, the only thing I'd add to it is the CQC review, which I think you've just alluded to. It wasn't as exciting, I think might be the right word, as we hoped it would be. But what was apparent was that they were, and then the report will be coming out in probably the next week or two, but they were certainly pleased with the partnership arrangements across health and social care, public health, district councils, the fact that we'd all worked together so well over COVID from the very onset and not tired of it, which I think is the important thing, because some areas of the country have, you know, you can see by people's behaviour that they've kind of given up a bit because it's all gone on for too long. And I don't think that's the case for certainly not our statutory organisations anyway, that there's still a great enthusiasm to manage this pandemic collectively. And I think I would put a word in for the acute hospital and how well they've coped with people who've had the infection and have recovered from it. The statistics are quite significant in Gloucestershire for the level of recovery. And if you look on the website each week, they're published and they're often higher than some of our colleagues across both the South West and into Oxfordshire and the West Midlands. So they've done extremely well to manage those respiratory conditions.
That's good to hear. Thank you very much. Okay, are we happy that we've covered that? And what have we got next on the agenda? What's next, Joe?
I think it's me.
Yep, you're right.
Sorry, taking my minutes there. Okay, the next one we're looking at is Margaret's report.
You're right, yes. Thank you.
Yeah, so just swapping screens. I've talked a bit at the beginning of the report. I won't go through the detail of it. I'd rather take questions that you're interested in having read it. But just to pull up the sort of key features, the partnership board experience through COVID has been really interesting. So we usually have partnership boards according to the disability or disorder. But in COVID, we've been having cross sector, whatever the correct term is, a partnership board for everybody, and we've been having them on a weekly basis via Zoom. So the attendance has been absolutely spectacular because people have got to travel, they haven't got to find anywhere to park, they haven't got to find access to a building, and it's quite interesting to see a group of partners and service users who are really embracing the sort of electronic answer for this. So that's good. There is the issue about isolation, which I think people have largely underestimated. And I think it's exposed that isolation for people who found it very difficult. Let me just go and scream at a dog again. Why do they have to bark when I'm speaking? So that's quite good. I think The carer service, I think, is something that we need to be mindful of, that a number of carers are getting quite exhausted by the process of looking after people for long periods of time, and therefore we are trying to concentrate our carers hubs on supporting people so that they can carry on caring. We have now opened all of our day centres and respite units, but interestingly, about a third of people are not coming back because they have found other solutions to their needs in the time, or would prefer to have home care. And then safeguarding referrals. I've put a bit in about the services, obviously, that we've continued to run. But safeguarding referrals had a peak for a while during COVID. They've settled down again, but there is no doubt that whereas in children's services, I think it's right to say that when the schools were closed, the amount of safeguarding referrals to children's dropped. That hasn't been our experience in adult services. They've actually gone up. And whether that's because people are more aware of individual needs or are more cautious, we don't know, but we're looking at the conversion rate from the referral to an actual case to see if we can determine that. So happy to take any questions.
Thank you. You want to go and give your dog a daffodil? Okay. Oh, she's gone. Do you want to carry on, Sarah, and then we'll come? Oh, she returned. Any questions for Margaret, members?
Brian's.
I just wondered what the impact has been on people placing their relatives into care homes since this. I mean, presumably people are still reaching an age in life where they need, or with disabilities and things, where they need to consider using care homes. Has it changed people's attitude towards them and how they respond, and what sort of difficulties maybe that providing for families trying to cope?
Yeah, no, it's really noticeable, Brian. The number of referrals have dropped significantly. We've got one home in the county that has 60 beds and only 20 residents because nobody has referred, both ourselves and self-referrals. It's really dramatically, I would say, nationally and locally, changed people's attitude. Sometimes I would say unfairly, because I think care homes have acquired a bit of a bad name at the beginning with it because of the number of infections and significant deaths. That has steadied out, and care homes have, I mean, you've heard me say this before, but they are called care homes for a reason. They're not hospitals, and therefore the whole clinical environment that they've had to learn to step up to has been quite challenging, I think, for some of them, and not in their culture, because they want to be kind of warm, friendly, cosy places with lots of cushions and afternoon tea and all the sorts of things that we, treasure in our own homes, is what they're trying to replicate in those homes. But COVID has taught them that actually they need to think about the clinical aspects more intensely than they did before. So we've seen a drop in requests for care home placements. We have placed fewer people ourselves, but we've seen a steady rise in domiciliary care. So people, relatives are more prepared to look after somebody in their own home now than they were before. I'm sure at some point this will steady out, but I don't know. I mean, there will be an impact on businesses. The important thing for us is to make sure that those businesses that could go and that we could accommodate go, rather than the ones that we really need, like the high-end dementia care and challenging behaviour homes, neurological conditions, that sort of thing. But yeah, it has changed the environment completely.
Thank you. So there will be a bit of a shakeout probably in that sector, but there must also therefore be an extra demand on support in the home. are we coping with that okay? Because obviously, if you've got people with significant dementia issues, for example, the caring in the home can be quite challenging.
Yeah, I mean, I think, and it'll be interesting to see whether day services demand picks up, because at the moment it hasn't been huge. People have preferred either to manage because they don't want somebody in their home. We've had a number of cases where people have not accepted domiciliary care because they don't want a stranger in their home. I think that's beginning to change now from the numbers that we see, in that people are beginning to feel safer and they know that the PPE is available and they know what good practice is and all of those sorts of things. But we have seen some remarkable situations. I can think of one family who were having a significant amount of care that have managed between themselves. They're getting a bit tired now, I think, and they probably will be willing to accept care. But yes, it has changed. It's certainly changed that business environment.
Thank you.
I've got Councillor Robinson. Who else wants to ask a question?
Yeah, thank you, Chair.
Robinson.
Thank you. To Margaret, I have in my division a long-term homeless person, and I'm just concerned about the rise in the self-neglect there. Tremendous rise compared previously, and as I say, he will sit around with no socks on, no top on, outside Tesco's on the wall, and it's really concerning to people. How could you explain a little bit about that increase and how you're trying to cut that back, you know, to a more acceptable level?
I could, Steve, except it's not my part of the world, unfortunately. It's Sarah's. So can I bat it over to her? I know a bit about what's happening with the homeless services, but I'm certainly no expert, but she will be.
Okay, thank you.
Okay, so my team are responsible for commissioning accommodation and community-based support, and sort of leads neatly on to my next report on the agenda. And we've also played a key role working with the 6 district councils in the COVID emergency accommodation protocol that we activated early on in March to bring all rough sleepers in during COVID, and obviously now are committed to providing sustainable housing solutions for them. I think, though, as you've described, Steve, sometimes people that are homeless have a range of quite complex needs. They find it difficult to live in a way that some people find acceptable. Some of them are experiencing, you know, the impact of trauma. Some of them have mental health problems, the substance abuse problems. So there's a whole range of services that are outlined in the report. I think it might have been you that requested the update on homelessness. So we've talked about what we did during COVID, initial stages of COVID, and we've given you an update and a link to the previous reports on community and accommodation-based support. But we've now, the districts are now very much handling that longer-term housing solution issue. We've helped write a bid to MHCLG for funding for that, and we've then sort of reverted back to our original role around entrenched rough sleepers and the community and accommodation-based support. So we had some pilot funding from MHCLG about 18 months ago to do some quite innovative work with people, just like the gentleman that you've talked about, who are really entrenched rough sleepers, who are people find quite difficult to help. And so it takes a certain approach to try and bring them in and give them the support they need to try and find them a housing solution that suits them, because no one wants anybody sleeping on the street, certainly not without shoes or socks on or tops on. So he sounds like a man that's got some complex needs. So there's somewhere safe to stay help. So these places where we would bring someone in and give them some very intensive support for 72 hours. To understand, they can have a bath, they can give them clothes, they can wash their clothes, that sort of thing. So to bring them in, get them warm, fed, and then work out what it is they need. And then there's the navigator process where we can bring a whole range of other services in around the person to give them the support they need. This is also just summarising the paper. So I think that gentleman would be sort of a suitable candidate for that. It's worth saying that we sometimes bring the same people in over and over again, and sometimes they just don't want to work with us, or what we're offering doesn't meet their requirements. So it's not always a linear process. Sometimes we go through this numerous times with these individuals. So, I mean, if you've got the details, I'm certainly happy to receive them, and I can pass them on to the team to see if they can go and work with them.
Could I just come to the chair? Yeah, I mean, this gentleman has been helped on many times when brought in. So I'm not saying that he hasn't been helped. He needs to want to help himself, but he has been helped a great deal, and all the services have been dealing with him. I only brought that up under the safeguarding adult team that I was. Yeah, that's all I was trying to get an idea of. That was all. Thank you.
And just to come back on that, just because we've helped him before doesn't mean to say we're going to stop helping him in the future. So that's the purpose of the services. We do keep on going back, and we do still have rough sleepers in Gloucestershire. So the purpose of the services to keep on working with them until they find a solution. So we'll continue.
Thank you. Sarah, any more?
No, I've just sort of given a really quick summary, sorry, of my papers. It was, I think, in response to a request from the committee for an update on homelessness.
Sure.
So, so I'm happy to take further questions. And just as a bit of an update, there's the number of rough sleepers quoted now. I think I haven't got the paper. Is I think 34.
34,
it went down.
Yes.
It went down yesterday to 22. So. So that's good news, but we do see it fluctuating from time to time. So, so we are working with the cohort of any time between 20 and 30 rough sleepers at the moment. So the services are quite busy.
Fine, thank you. Do we have any more questions or comments, members? No?
I'll just add one other comment, and that is that we are beginning to see a rise in mental health referrals. I got the figures yesterday for ED presentations of self-harm or various other mental health distress situations, and there is definitely a pickup, and people are beginning to see the consequences, particularly of the isolation, I think.
Yeah.
Pick up on that, Margaret. I know that the County Council in particular has put in some extra funding into mental health services and in particular counter-suicide services. Do we have any figures to report back to this committee on the take-up of those services? Do we know? Because we're hearing in the national media that the suicide rates are going up, and you've mentioned mental health problems going up. So is that being reflected in the number of people who are using our very welcome enhanced services?
Well, I'm going to dodge it again, Ian, because I haven't got those services. Sarah has. So I'll pass it to Sarah. But I know that the core services that we've got, which I do have under my watch, we are seeing a rise in referrals to generic mental health services and specialist mental health services. But Sarah's got your money, basically.
So we are seeing the services are being well used. I don't have the data to hand, but I can certainly put it in my report next time and perhaps have a focus on mental well-being, because we are at the moment planning our next suicide audit as well. So all the indications are that the mental health has suffered during COVID, but we need to try and sort of dig beneath the data to understand the impact of that. So we have commissioned some additional services, and I can tell you they've been well used. We have a waiting list certainly for our counselling service. And that's good in the sense that people are accessing it. So we thought there was a need out there. There is a need. So we are now having to have a waiting list, which is unfortunate, but we've still got more capacity in our mental wellbeing services than we had before. So perhaps I can put together a report for next time and bring them.
It would be a good follow-on. Thank you. Anybody else? Have you completed your report, Sarah? Thank you. Wayne's been very patient. But now, Wayne, it's your turn.
Thank you very much. There will be a slight touch on COVID, but you're probably relieved to hear that actually it's just a general update following the flow of the report. So you've got the report in front of you. I think in terms of picking up in the order that it runs, give you some updates on the HMI CFRS inspection process and also the improvement board progress, which, if you recall, is our internal audit process. So in terms of HMI CFRS, we are due to be re-inspected on the 22nd to the 25th of September, which will be a virtual inspection this month, and that's to do with our fire protection function, which you will recall had a cause of concern in terms of the way we assessed risk and the capacity that we got within that team to actually audit the risks and fulfil the statutory duty that we've got in relation to the regulatory reform fire safety order. So we have made significant progress with increases in both the size of the team, but also the qualifications. As recently as last week, we had 2 of our inspectors achieve qualifications to level 7, which is the highest level of fire protection inspection capability. So we can carry out the full range of inspections, and by the middle of next year, the remainder of inspecting officers will also be qualified to a minimum of level 4, which is the National Fire Chiefs Council recommended standard of qualification to carry out fire protection inspections. Obviously, the inspection process has been set back some way due to COVID for a couple of reasons. One is that obviously we've had to ensure that we've undertaken a COVID secure approach to that. So they've predominantly been desktop audits. But the second reason is that obviously a lot of businesses have been closed. So access to them to carry out the audit in the first place has been made slightly more difficult. But as those businesses reopened, we obviously, through the GCC COVID plan structures, made sure that we recommence those visits as soon as possible. And now we are, again, fully active with business fire safety audits and supporting the business community. We've also taken part in a significant amount of kind of peer support with other services who achieved better inspection outcomes than we did. So we've checked our risk-based inspection program and the methodology that supports that with those other services. We've attended a couple of National Fire Chiefs Council events to test out some of the concepts that we're using as well. And I'm relatively confident that we are doing all that we can at the moment. And I'm really interested in seeing what the HMI's view is when they come back at the end of this month for a 3-day virtual audit. What we've also done to satisfy ourselves that we're doing all we can is commission the Local Government Association to carry out a peer review of our business fire safety function. That should have taken place in June. Unfortunately, they ceased all their inspection activity or their peer review activity. We did try to get that rescheduled to take place ahead of the HMI CFRS inspection, but unfortunately we couldn't do that. So we are just, as we speak, looking for a date, hopefully early in October, when that peer review will still take place. And I think it's still positive news that we can mention to HMI that we are seeking peer support. So we're looking for collaboration. We are looking to continually improve and check that we're moving in the right direction. So that's where we are with the cause of concern in relation to business fire safety. The HMI CFRS have also been commissioned by the Home Office to carry out a COVID inspection of all fire and rescue services. So they're looking to see how the fire and rescue service responded to COVID, and they're looking specifically at the resilience of the fire sector. So how did it cope in terms of making sure it could maintain frontline services, in addition to what else did it do to support partners, the local authority, and support community resilience in terms of particularly the reduced demand that we saw from the type of incidents that we normally attend. And I think it appears to me that part of the reason to that is to see how we use that capacity. So what did we do to use that capacity to best effect, and how did we demonstrate effective collaboration and partnership working? Because if you think about it, in England, effectively 31, 32 of the fire and rescue services in England are standalone organisations. So working with the county council would be classed as collaboration or partnership activity. For the 12 of us that are part of county councils, it's business as usual. We are Gloucestershire County Council staff and resources, and taking the industrial relations elements aside, we can be deployed, or it's appropriate that we are deployed as county council staff. So in support of a lot of the good work that you've heard Margaret and Sarah talk about, as you know, we've had staff actively out working with care homes, with other blue light emergency services, a whole raft of activity that you're well aware of. So it'll be interesting to see how the HMI report that activity, because I'm relatively confident that Gloucestershire has done at least as much as the highest output fire and rescue services anywhere else, if not is leading the way in terms of the range of activity and the volume of activity that's been undertaken in support of adult social care, public health, the LRF, the ambulance service. We've done at least as much as anybody else, if not more, and hopefully HMI will recognise that. Where that goes afterwards will be quite interesting, because we believe, or I believe professionally, that report has been commissioned to support a view of the role of the fire and rescue service in England, and how we can develop the role of firefighters, which will go into some kind of employer-employee negotiation process around the contracts and terms and conditions of firefighters. It's quite a pivotal point, and I'll be interested. It's a 2-week inspection. They've commissioned a 70-question staff survey, so yet another survey about COVID. We are pushing that hard with our staff, because we want our staff to genuinely talk about their experience of working through COVID. But we think that will be a positive story, whatever our staff say. You know, we've had some bumps along the road. You've just touched on mental health. We have seen some concerns from staff around mental health and well-being for a variety of reasons. Obvious ones around some of the response to COVID, and particularly the temporary rest facilities and body recovery, etc., which we expected, and we've put quite a comprehensive package in place, both locally through the Fire and Rescue Service, but specifically through the Employee Assistance Programme with County Council as well. So I'm confident we're doing all that we can there, but I think it will paint us in a good light in terms of the amount of work and how much the staff felt that they could contribute to a difficult situation. In fact, if anything, I think they'll say they wish they could have done more. That's the noise that's coming back to me at the moment. So that's it for HMI. In terms of our improvement journey in general, you'll see there's a section on the improvement board. Believe it or not, we established the improvement board a year ago this month to start to address the findings of some of the audit reports. And if you recall, there were 123 recommendations or actions that came out of the 18 or so audit reports that were commissioned. And obviously there was the scrutiny group that was established with cross-party membership that was involved in the initial stages of that and was well briefed on that. It's quite easy to lose yourself and get your head down and keep pushing forward to address some of those issues. But I think the benefit of the improvement board, having some objectivity on there with people from other parts of the county council to add a degree of scrutiny and effective governance is useful, because it was Darren Skinner, to his credit, who reminded me that it was a year, because I was head down running at full pelt in the last meeting when Darren said, do you realise it's a year since we started? And effectively, out of the 123 audit actions, there are only 36 outstanding to work through. Now, effectively, we started the work in the improvement board in the August. We had a little bit of a stutter at the start, and it took a couple of months to get it to stride in terms of how that board worked, how the process through the governance would work for audit risk and assurance to sign off some of those recommendations. And I'm really pleased to say that effectively we have 36 outstanding actions to complete, while some of the rest of them move through either a wider GCC response. So within that, there are some audit actions that were effectively assigned as a result of the individual audit reports, but they're a corporate issue. So, for example, it might be an issue associated with an accounting instruction or a contract standing order or the constitution. So those issues are being taken forward corporately, and the other remaining, the other outstanding audit actions have already been passed back to audit, who have to ratify that they are happy with the action we've taken and report them to Audit and Governance Committee. So we're hopeful that we'll have well over 90% of those audit recommendations in a position to be able to report to Audit and Governance Committee in January that they're completed. We don't think we'll have all of them. We wanted to, but we don't think we'll have all of them, which means that we'll mop up the final few in the April Audit and Governance Committee. But the way we address those within the Directorate and within the Fire and Rescue Service will be as business as usual, and we'll try and look to wind up the improvement board and move it into a portfolio management approach that we've established within community safety, so that improvement journey will continue, but it will become part of the more general improvement journey that's looking more effectively at the HMICFRS findings and the cultural elements that I'm really keen. We've been working on them anyway, but I'm really keen that we establish those more effectively and make them part of a real clear approach that we're taking within the Fire and Rescue Service. As you'll be aware that we did some values work back end of last year. There was some further work to continue at the start of this year, but that got overtaken with all hands to the pump, effectively supporting the response to COVID. So we're in the process of picking that up again at the moment. That brings me on to the business planning section. In terms of our integrated risk management plan, you'll be aware that that's a legislative requirement under the National Framework for Fire and Rescue Services. We have to have an integrated risk management plan or a community safety plan. As a commissioning council and as our fire authority, you as councillors commission me to deliver an integrated risk management plan on behalf of the authority. That's what the HMICFRS measures against. We have a plan which contains objectives. Does that plan accurately reflect the risks that exist in Gloucestershire, and do we then resource the plan to address the risks we've identified? So are they satisfied with the quality of the plan, and do they think we can deliver against it? Our plan was due to expire next year. The planning cycle, it doesn't appear to me, was aligned with either the County Council corporate planning cycle or really a couple of other key plans that exist that we should be taking significant cognizance of in terms of producing a risk management plan. So Cabinet has recently approved that we have a 1-year extension to the current integrated risk management plan to take it to 2022, and that allows us to create a 22 to 25 IRMP, which will align with the next County Council corporate plan when that gets produced, which makes sense to me, so that we can make sure we contribute to the objectives of the County Council. It also allows me to take advantage of a significant programme of work that the National Fire Chiefs Council are undertaking, which is to standardise the integrated risk management planning process within England and effectively give us a toolkit for what good looks like and how to produce that, such a plan. We've had the extension, which is good news, and we have started work. In fact, this week, yesterday, we had a workshop on developing the next integrated risk management plan. and we are doing it in a much more evidence-led way than we have historically. So hopefully we'll be in much better shape in terms of HMI assessing how we've looked at risk and then how we organise ourselves against the key risks that exist within Gloucestershire to make sure that we've got the right resources in the right places to be able to address those issues. We'll also be taking account of a very broad range of information. So things like the health and wellbeing plan, as I said, the county council's corporate plan, community risk registers, national risk registers, counter-terrorism local profiles, police and crime plans. There's a raft of information that will feed into the integrated risk management plan to make sure that we are organised as effectively as we can be. I'll pause there. Are there any questions so far before I move through the last couple of sections?
Anybody have any questions or comments? Councillor Hilton.
Yeah, I've got a question related to the fire and rescue service. It's related to the police and crime commissioner's attempt to take over the fire and rescue service. Because I understand that the government has basically said that they won't be considering any takeover bids until after the elections next year, and two, that there would have to be a completely new bid put in. Just wonder what the current status is in Gloucestershire with regard to that bid, and two, whether there's been any changes in other parts of the country that, or information in other parts of the country which might help us retain the fire and rescue service as a county council run service.
Happy to
like a political comment on that.
Well, there's a non-political answer, which is the factual position, and then
give me the factual, and Dave give me the political one.
I'm sure Dave will pass comment if he feels it's appropriate. So yes, you're correct, Jeremy. The new Fire Minister, Lord Greenhalgh, has written to, in fact, also the Secretary of State for Policing and Security, I believe, has written to all PCCs who had a business case submitted, advising them that no further business cases will be considered at this stage, and if they currently have a business case to take governance live at the moment, it will now no longer be considered until after PCC elections in May 2021. If they do want their business case to be considered after those elections, they'll have to submit a revised business case. So effectively, yes, a new business case or an updated business case will be required. Part of the reason for that is there is a two-stage review taking place. One stage is currently live, and that is a review of the effectiveness of PCCs as PCCs to date, and that's a policing matter or policing governance matter, and the Home Office have commissioned that review. That's phase one, and that takes place now. Then there's the election next year, and then immediately after the election next year, phase two of the review starts, which is a review of the potential to broaden the role of the police and crime commissioners and its fates to include a variety of functions, for example, the governance of fire and rescue services. So phase two will be, I think, or the outcome of phase two will be the catalyst that either stops any further governance bids or, I suppose, generates PCCs to submit new bids once the phase two outcomes have been published, which we expect to be October, November next year. And then in terms of the state of the current bid, then effectively there isn't one. What it does for the sector is it puts every fire and rescue service back in the same position it was immediately at the point PCCs were given the legislative position, I suppose, to submit a bid if they wish to. So we're all in the same boat, effectively. in terms of noise from the sector, my understanding is that Lord Greenhalgh has commissioned a task and finish group that is being advised by both the LGA, PCCs and PFCCs. So don't forget there are already 4 police, fire and crime commissioners in the country as it is. They've also got chief fire officer representation on that task and finish group from each of the different governance models. So Metropolitan Fire Services, Combined Fire Authorities and County Council Fire and Rescue Service to look at governance of the Fire and Rescue Service to try and, my understanding is it's to try and make some sense of it because there are so many different governance models. It needs neatening up. And that's all we know at the moment. The only other area I mean, there are various county council fire and rescue services. I think interesting to look at Cornwall fire and rescue service. I mean, obviously there's no kind of noise there about any kind of governance change for Cornwall fire and rescue service. Part of the county council down there, and it's difficult to see how anything would take place. And we, you know, other than a lot of water, we share quite a few similarities. I don't know if Dave, you want to add anything to that?
Jeremy would be very disappointed if I didn't add something.
Would you be disappointed, Jeremy?
Based on the factual response that Wayne has given you, which is clearly accurate and is the process by which we are bound in the way that we're moving forward, I've taken every opportunity to speak with MPs within the county, and also through my role of sitting on FSMC, I've had the opportunity to speak to other MPs from all different colours of the rainbow in respect to what colour rosette they wear, and they've all provided some very, very interesting background information into respect of the process as it would move forward. I think we're in a situation that there is so much going on in government at the minute, and having spoken to a minister, he made it very clear to me that the issues around any suggested change in governance of the Fire and Rescue Service is something that's a long way down the pile at the moment. There are far more significant issues that have got to be addressed by government over the coming, he suggested, 24 months. Please be assured, Jeremy, that all the tools in my box are sharp. I continue to sharpen them further with Wayne and others, and Wayne's mentioned the National Fire Chiefs Council. There's a new chair of that who actually is a chief of a county council fire and rescue service. We've coordinated a meeting of all the county council fire and rescue services that will be chaired by that chief fire officer. And we're going to take the opportunity to come together and try and make sure that we don't miss any tricks to push forward in the way in which, unified as the 12 county council fire and rescue services, we will make it quite clear to government that we believe, and I think the example of COVID clearly shows that a county council fire and rescue service, that type of governance, is something that provides strength, provides unity, but above all, provides a service to the residents that we provide, which is over and above, with respect to those who have a combined fire authority, is over and above that, because Wayne sits around a table with the whole range of directors. He doesn't have to make appointments to talk to Margaret or Sarah. They're actually in the room and they don't have to make an appointment to see him. So if there are issues where the fire and rescue service can do more, the county council governance model is the right way forward. But I would say that, wouldn't I? But don't worry, Jeremy, as long as your party continues to support the move forward of retaining the governance, and I hope Steve's party does exactly the same, we will ensure that we will do all we can to keep GFRS as part of the county council.
Thank you, David. Thank you.
Thanks to both of them for their informative response. And I'm fully behind Dave Norman in retaining the Fire and Rescue Service as a county council function.
Any more comments or questions, members? Have you completed your report, Wayne?
Couple of last bits around the other functions within community safety. Stephen, I'll go as quick as I can just to wrap up on fire. You see there's a bit in community safety. Most services are now being reinstated or have been reinstated around the role of fire and rescue. Just draw notice to the fact that we've now stopped our support to South West Ambulance Service. That's at their request. We are no longer crewing ambulances with firefighters, but I have to say that has been an absolutely phenomenal initiative. Over 6,000 mobilisations attended by ambulances that were crewed by either jointly by SWAST and the Fire and Rescue Service or by the Fire and Rescue Service. The staff that have been involved in it have, my understanding, it's been difficult, but they've thoroughly enjoyed it. It was on a voluntary basis. They've learned huge amounts about the role, which is great for the work that they do in their role as firefighters. So you imagine now they're back on a fire engine, and that skill and knowledge that, I mean, they were trained and competent before, but the experience they've gained to support that skill and knowledge is just going to benefit the people that we respond to and help now in our day-to-day work. So great piece of work there that they've done, but unfortunately that's come to an end. We're now back in the industrial relations negotiations around role of firefighters, which is something I'm involved in nationally and pushing hard to try and get that resolved because it's gone on for far too long. We've also great news for some of our on-call. So in your divisions and your areas, you will have on-call fire stations. The commitment given by on-call firefighters is absolutely staggering. In addition to their obviously their personal lives and their primary employment, and a lot of people do that with the hope that they can secure full-time employment as firefighters. So really great to say that we've had a two-phase recruitment process. First phase is to migrate eligible and appropriate on-call firefighters into the whole-time workforce. We completed that in June, and 16 of our on-call firefighters secured full-time employment as whole-time firefighters with us, which is great news for them. It demonstrates movement and progression for the on-call workforce. And now we're starting later in the year with our public whole-time recruitment campaign, which will obviously involve a lot of positive action as well to try and maintain the direction of travel with the recruitment of female firefighters, which is nationally an issue for females being underrepresented in operational roles. And we're having a real push on Black, Asian and minority ethnic communities as well, because we're pretty much in line with the national average, which is significantly lower than our local population statistics. So we're having a real push on that this time. That's good news.
Thank you.
Very quickly, trading standards. They've had a difficult time in relation to the impact of COVID and having been able to get access to premises and carry out face-to-face inspections. They've now restarted some of the Food Standards Agency work and work into animal feeds, and they've seen a significant increase in scam reporting, particularly doorstep crime, which has tripled during COVID. So they're able to resume physical visits. They are having a real push around that doorstep crime issue and doorstep scams, which is affecting some of the more vulnerable and particularly some of the elderly in our communities, which is unpleasant. The next thing that they're working through, and it's beyond their control, but it will have an impact on some of their income targets, is going to be around the suspension of magistrates and Crown Court activity. There is a lag in some of the income, but obviously trading standards makes a significant claim against the proceeds of crime or under the Proceeds of Crime Act, and obviously the backlog in the court system will have an impact on that. So that's something we're keeping a close eye on at the In terms of coroner's service, obviously they are continuing to carry out the work. That work doesn't stop. It's not COVID related, important to say, unless there are unexplained circumstances around the death. So in terms of the COVID impact on coroners, that's just about a COVID secure work environment, but obviously they're all infection prevention and control trained to a high level to carry out that work anyway. The more significant issue is around the bereavement care issues for families and delayed inquests into unexplained death. The coroner with made sure that inquests can be carried out virtually, the process can be speeded up where possible, and if it does need to be a physical inquest where a jury is required, for example, we can create new processes to start those small and develop physical inquests when needed. And then finally, civil protection team, obviously they've been extremely busy with both the flooding that was going on at the start of COVID, then the COVID response, business continuity support to the whole of GCC, and maintaining that 24-hour a day, 7-day a week point of contact to the office as well. We've managed to increase the establishment level in there, which has been absolutely critical, really, because they also support 6 of the district councils, not all in Gloucestershire, one being West Oxfordshire, providing the emergency planning stroke civil protection function for those organisations. Those service level agreements were live when we were really struggling with capacity and inundated with work. So the extra capacity in there of a couple of people is allowing them now to service those service level agreements effectively that are being re-signed. That offsets some of the cost of that team, which is quite useful. But it's also allowed them to really get into the business continuity approach for the county council. So there's a paper in CLT this afternoon around an updated and revised business continuity process, and the Business Continuity Assurance Board is meeting again later this month. So we're really dusting off and bringing that up to date with a lot of the learning from COVID and what we had to do in the very early stages of COVID response. So that's useful. And they're also looking at the emergency response structure across the county council. And again, the additional resources allow the time to review some of the emergency management plans, but also start to look at how we organise ourselves as a county council. And either next or the one after CLT, we will be getting a paper on the emergency response structure, which includes things like how we respond, how we manage the plans, how we manage the executive on call rota, and importantly, how we deliver training to elected members and what training is delivered to elected members, so that you can apply the right level of scrutiny in the best possible way to officers when they're managing response. The final point on that is that Councillor Norman and I confirmed, I think this morning, are contributing to an LGA member development training package, which is designed to assist members to apply scrutiny during significant or unplanned events. So how can scrutiny be as effective and supportive as possible during events like COVID? So we're both contributing to a piece of work that the LGA are doing on that. And that's it. Stephen, thank you.
Thank you very much, Wayne. Any questions? We've got Councillor Orford over here. Councillor Orford. We've got Councillor Hilton and we've got Councillor...
Sorry, Chair, it was just as I emailed you earlier in the week, sadly I've got to leave because I've got another briefing starting in a few minutes' time. So just to say, don't worry, I've not crashed. It's that I have to go on to something else.
Okay, thank you, Phil. Thank you very much. Who have we got here? Councillor Hilton, then Councillor Wells.
Yeah, thanks, Chair. I've mentioned this before, and certainly when we had the tour of the depleted trading standards service at the Tri-Sewer Centre at Wardwells, it was mentioned then that trading standards might have difficulty coping with a foot and mouth outbreak because we're responsible for looking into livestock movements and stuff like that. We now have to deal with the COVID-19, and it says here that 25% of all the inquiries were to deal with the effects of COVID-19. I just wonder, in view of the fact that Dave Norman put in a very excellent bid last year to see the Fire and Rescue Service have its finances boosted quite considerably, is it enable an extra 17 members of staff to be employed? Is he planning to do something imaginative with regard to Trading Standards Service, which has had its budgets slashed in half? There's nowhere near as big and strong as it used to be. Should we not be looking at reinvesting in this important service that's there for public protection matters and protecting businesses from rogue traders, protecting community from goods being sold in shops and things like that, consumer safety? Surely this is now the time for Dave Norman to be brave and ask Mark Hawthorne for some additional money to strengthen the service.
I hope I'll always be considered to be somebody who is brave and fights the good fight for the full part of my portfolio, whether it's in respect of the library service, whether it's in respect of parking, reviews, etc. But clearly the community safety element of my portfolio is really significant. And I understand what you said, Jeremy, and I think you've actually asked me the same question at least once before. My answer will not change, and that is I will do all that I can to ensure that all the services within my portfolio are funded as far as is reasonably practicable in respect of the long-term budget issues that all local authorities will suffer with going forward. I think we have to accept that the costs on local authorities will continue to be pressured. I think we have to understand that the way forward is through partnership working. And I know jolly well that the Trading Standards team work very successfully in partnership across the Southwest. And a lot of the work that they do in Gloucestershire is supported by others, Trading Standard teams within the Southwest. So if there's the opportunity, Jeremy, to get more money, you can be absolutely certain that Norman will be front and centre and pushing for that money. But Norman does actually understand that sometimes you have to be realistic and accept that you keep your pot boiling, and when the time is right, you turn that up a little bit farther on the gas or electric. I've never cooked with electric. Turn the gas up a little bit farther, and then lean on the leader and your cabinet colleagues to ensure that the point that you've made, now it needs to be addressed. So it will still feature in my long-term aims.
Thank you, Dave. Councillor Gravels.
I think I was listening carefully to Wayne's long presentation. Wayne, you referred to the joint working with SWAS, the ambulance service, coming to an end. Did I hear that correctly?
Yeah.
Did I hear that correctly? Can you tell us why that's come to an end?
Yes, it was a time-bound request from Southwest Ambulance Service. Initially, it was for a period of 6 weeks, and it had 2 extensions just to help them in their preparations for winter pressure. We did think that it might extend further as they get closer to or deeper into the winter pressures. But that's not the case. So it's predominantly been to support 14 additional ambulances to be available across the Southwest to make sure that the impact of COVID on the ambulance service didn't overtake their ability to deal with their normal day-to-day business. So it just came to an end in line with the scheduled end date. And there was also an element which was nothing to do with Gloucestershire, but a national fire service issue where the LGA, as the employers, who are classed as the employers, the trade unions and the National Fire Chiefs Council, on behalf of the Home Office, negotiated with the trade unions to allow firefighters to undertake this role in support of the ambulance service, because the trade unions, or particularly the FBU, believe that it is outside of the role map of firefighters. So it's important to note as well that agreement nationally ended some time ago. I think it ended in July, and we continued to provide that service to the end of August outside of the national agreement. And not that was a reason to stop us, but it was always a factor we had to keep our eye on in case it created industrial relations tensions locally, which it didn't, but we were keeping an eye on it.
Thank you. Any more?
Yes, Stephen. So just going back to that, Wayne, I think what you said was earlier on that the firefighters actually learned a lot, and it helped them in their job working with the ambulance service. Is it possible, not what I call providing extra support, but to do some form of exchange so that firefighters can broaden their understanding? Or do you think because of national agreements and things that's not going to be feasible?
No, it is, and in fact, we have done it in the past. I'm aware that it's been done here, and I've certainly done it in other places that I've worked. But we do exchanges or ride-alongs, whatever you want to call them, where a firefighter or a member of fire and rescue staff will provide or be the third crew member on an ambulance, just to gain experience and exposure and to hone their trauma care skills, because we train them to a higher standard of first aid anyway as part of their role. Often they're first on scene at road traffic collisions or burn victims at a fire, for example. So they have an enhanced level of training anyway, and it's always really useful to get them to spend a couple of shifts with an ambulance, because obviously the volume of calls the ambulance gets, they get more exposure. So we do that, and we will continue. And the way we get around the potential industrial relations tension is that we offer it on a voluntary basis to staff. So it's not mandatory, and those staff that want to do it, we facilitate that for those that want to, in light of the national negotiations.
Thank you.
Okay, can I just come back? So I don't know if it happened to anybody else, but I lost the connection there, and I missed all of that. So I don't know if that was across the whole system or just here in parts of Gloucester. In terms of that work, Wayne, I didn't quite follow, because there was quite a long gap when I was trying to reconnect. Are you saying that it will continue in some way? I didn't quite understand that. Because we all know the issues around ambulance response times, particularly in the remote areas of Gloucestershire as opposed to the urban areas. Can you just clarify that? I appreciate that time's ticking on. I don't want to take up too much time, but for those people whose lives it saved, it's a really, really key issue. And for all of us, indeed, obviously.
Yeah, it's hugely positive. So what I can confirm is that, again, on a voluntary basis, we continue to respond to cardiac arrest in fire appliances, and we have co-responders on certain stations who respond to medical emergencies on behalf of South West Ambulance Service. But the firefighters who were crewing the additional ambulances in Gloucestershire, that has ended, and it's come to an end as a result of a time-bound end to that agreement anyway. And I think the follow-up that you might have come in on was that we do offer firefighters the option to volunteer or go along and ride along for additional shifts with the ambulance service to keep their skills up, but that's not part of any formal agreement as a result of COVID.
I think that's ambulance response times across. When you speak in your introduction to this part of your report, I think all of us would want to be associated with the generous words that you said about the men and women in your teams who have taken part in this work with SWAST. And I think all of us as elected members would want to be.
Here. Councillor Gribelli is buffering at the minute. How's it going? Okay. Does anyone else have any comments or questions to make? I did note that there was a very comprehensive report regarding the executive decision regarding the disposal of vehicles, which is now very well systemized and procedurized, which would stop a repetition of the unfortunate happenings of 2 years ago. And I'm very pleased that's occurred. Thank you very much, Wayne, and also to Colin Chick for putting that together. It looks like a watertight procedure there, but really it's a bit dangerous to say something's watertight. It may not be till it's proven. Thank you. Does anybody have any comments about that report about vehicle disposal, members? No? No, thank you. We now go on to item number 8, the performance report. Quarter 1, 2021. The first person I'll ask to make a comment is Councillor Carol Way Martin. Still with us? Yes? No? Yes? Yes.
Thank you, Chairman. I'm having difficulty with the buffering. I'm sorry, I may disappear in terms of sound or picture. My apologies in advance. I think we can look at the document adult social care performance as read. There are some issues which have been curtailed because of the COVID-19 and the lack of data. And obviously, as we move through the process, we'll pick up on those in future reports. I don't think there's anything in particular I wanted to bring to your attention, but I'm happy to take members' questions.
Do we have any questions, members, about the performance report for adult social care? No? Thank you. The second area is Councillor Harmon's area, prevention, wellbeing in communities.
Hello. Yes. Yes. Thank you very much, Chairman. Just briefly to say, I think it's pretty clearly set out. Clearly, we've all been through a very challenging time, but it is important to remember that a lot of work has been going on, not COVID related, to keep the show on the road. And I just perhaps happy to answer any questions with Sarah's help.
Sorry about that. Okay, Tim. Have you finished?
Yeah, so take any questions if there are any. Thank you.
Are there any questions, members? No? Thank you very much.
Ian's waving, Stephen Ian's waving his hand.
Ian, sorry.
I'm just wondering whether there is any update. I wouldn't normally ask for this at this stage, but there's been quite a lot of talk about suicide rates going up. I just wondered if you had anything that you could let us know on that, just as an update to say what's been happening in the most recent quarter on that front.
So there is a lag in the official data for suicides because it's something is only a death is only classed as a death by suicide by the coroner. So the data is normally quite delayed. So I don't have the most recent data available to me because we work closely with the coroner to understand where there might be a death by suicide, but we use the official data for our figures. So I'm quite happy to bring a bit more of an update in terms of what we think are the trends in our next report, but I can't be drawn on figures until they've officially been classified as a death by suicide by the coroner.
Understand that.
So that is the most up-to-date data, the official data we have in the performance report.
Okay, thank you. Any more? And we come back now to Dave, the Norman, as he called himself this morning.
Just remember, in 1066, we brought education to this country. So the Norman will continue. Chair, clearly what's reported in front of you is fact. I can't comment in any way, shape or form about that fact. I've read it exactly the same as you. I believe it to be a true and accurate record of what is happening. But if any member wants to offline question me about any of that data, if I can't respond to that person, I will get officer advice to respond in a way that they would require. Thank you.
Okay, thank you, Dave. Neat sidestep there. Thank you. And then we come on to our final item, which is the work plan. But we're going to do it differently, Joe.
I've sort of inherited the work plan from my colleague Laura, who was conscious that while there are certain items that are sort of relating to the current position and are sort of geared up to future meetings, there was an awful lot of subject matters and suggestions for the committee to consider long term that may now be not as relevant or may need to be updated. So just a suggestion, would you like me to circulate the current plan to the committee with a few little notes and updates from Sarah, Margaret and Wayne as to whether the topics, these are the long-term topics, are still relevant or whether they may merge into something else, and then circulate that to the committee to see how they want to take them going forward. A little bit of a review. I don't know if members or officers want to comment on that.
Dave, sorry, the Norman.
The Norman. Just to say that I'm noting that against the meeting schedule 16th of March 21, the Road Safety Cabinet panel, I will report back on that work. Well, because of COVID, we've only had one meeting. That was one face-to-face meeting. I have set up with Laura the fact that we are going to have a virtual meeting in sometime towards the end of this month or beginning of next. I would suggest that cabinet panel, giving its opportunity to see through the agenda items that we established at that first meeting. I don't think we'll be ready for the 16th of March. So my request is that Joe moves that into June 21.
Okay, thank you.
Just bearing in mind also we've got elections in May, so we have to sort of take that into account, sort of PERDA and new committees, new administration, new councillors. So just bear in mind the last meeting in March, the next meeting after that will be June, and it may be completely sort of a different agenda process then.
Sarah?
Thank you. So the next agenda features the Director of Public Health annual report, and this year we were originally intending to write it about domestic abuse, but given the learning about the disproportionate impact of COVID-19 on Black, Asian and minority ethnic communities and the impact on health inequalities, we've written the annual report on that instead. So I'd like to bring it to the committee and present it to the committee, but it's on a different subject matter. I'm also really happy, as mentioned in the discussion with Ian earlier on, to bring an update on the mental health services we've commissioned during COVID, but also to ask whether the committee would like to receive an update on COVID, just the publicly available data that we've provided today, whether that would be helpful.
Members, do you think it would be helpful to receive an update at the next meeting?
Yes, I do.
Yes, so do I, yes. Not? Thank you. Wayne?
Thank you, Stephen. I mentioned earlier in my report about the new policy and procedure relating to business continuity management. Considering that's a statutory function of the local authority as well, it probably would be sensible to make sure some scrutiny is applied to that. So that can come forward, depending on the capacity on the agenda. We might bring that in January, because it looks like the November agenda is quite full. But again, I'll take advice on whether members would welcome that.
And Sarah,
we could all circulate sorry, we could, if there's anything that you ever need to have sort of input from the committee, we can always circulate outside of the meeting to get comments, views, and then bring the outcomes to the meeting if that helps the process on certain matters.
Thank you. And Sarah, you had two other points, didn't you? You wanted to raise. Was one about suicides?
So I'll incorporate that into my report on mental health and wellbeing.
Yes, please. Yes, thank you. And was there another item? No. Okay, thank you. So we'll then circulate. Oh, sorry, there's a lot of waving hands, frantic waving hands. First of all, we'll take alphabetical order. Oh my goodness me. Andrew Gravells. Two hands.
Yeah, two hands. Just wanted to make sure you didn't miss them. So, Sarah, I've read in the press the comments about the changes to Public Health England, and we know they've got offices in the southwest. How would that impact on us? And what's the latest information you have on all of that?
So it shouldn't impact on us directly. I've seconded some staff into Public Health England to help with the contact tracing and the investigation of cases. I think, from my perspective, in the southwest, we have a really good partnership arrangement with Public Health England. They've been nothing short of fantastic during the COVID outbreak, but we get so much more from them than just health protection. So we are assuming that there will be an organisation that takes forward all the functions of Public Health England. So we've been told that the health protection function will go and sit with Test and Trace and the Joint Biosecurity Centre, but they do so much more than just health protection. So as long as all the functions continue in one form or another, then I think we'll continue to be okay. But if we start to lose them as broader functions around tackling inequalities or health improvement, I think that might then start to have an impact on the work that we do. But I haven't had a further briefing on it. I don't think people in Public Health England have had a briefing on it either. So I think there's still work to be done to determine how that future organisation structure will pan out.
Okay, thank you. Who's next? Councillor Hill. Were you happy with that, Andrew?
That was fine, thank you.
Thank you. Jeremy?
Yeah, I'm just looking at the programme. I can't see any reference to looking at the 2021-22 budget in our work plan, and also future items that have trading standards, impact of Brexit on capacity, the trading standards service. I know we wanted to look at the trading standards service. It says autumn winter 2020. I can't see that in the actual work plan itself. I just wonder when those two items are going to come to us for some consideration. I realise the trading standards and Brexit, which nobody knows exactly what the outcome is going to be when we get to the 31st of December and we move into next year. But even so, I think we need to consider, don't we, both those items. But the budget, it's not being discussed, and I wonder whether we ought to have that in the plan. How is that going to work this year?
I could help a little bit on that one. I would think I will get an update for you and for members of the committee, but I would think the process that's been done in the past, where there's a separate scrutiny budget event or day is held, would be probably the same process. But I will get an update on that for you. But I don't think it will be at individual meetings. I think it will be a scrutiny day where all scrutiny members are involved from the various committees.
Okay, thank you. Who else is waving? Oh, Steve Robinson's almost lost his arm.
Thank you, Stephen. Yeah, I'm pleased to see the on the 10th the long-term viability of care homes. I know that when the two care homes closed in Stroud area, there was talk that that there could possibly be some development of existing ones to take some of the residents long-term that the availability of beds in Stroud, but things that have changed, we understand that, but that will still come along, will it? Are we still looking at different areas of the availability of of beds?
Yeah, so shall I pick that one up? Yes, I mean, when we've had 4 home closures in terms of OSJ over the last 2 years, nearly 3 years now, but every single person got the place of choice. So nobody was placed somewhere that they didn't want to be. And some people moved back to be nearer their families away from the area. So we continue to fund them, but they're not living in the county. We still have too much capacity. We've got more beds than we know what to do with. And so there will be some future discussions about potential closures of OSJ homes. Obviously, other homes, we're not so actively involved in any closure. We're only involved in finding places for the people to move to. And that's if a homeowner decides to close their business, or if they become financially stuck, or sell out to somebody else. And we've seen a few of those over the past few years. Probably we'll see some more at the end of COVID. So, yeah, we will definitely be looking at the capacity issues.
Thank you.
Okay, so we'll do that, Joe, then, what we said. We'll give people a heads up. You're muted, but your lips are moving.
So sorry, there you go. I pressed and it didn't work. What I'll do is I'll take everybody's comments from this meeting, suggestions. I'll take the current items that are planned for the next few meetings, and also look at the list of suggested items for the future, get a feel for them from officers, and I'll circulate that to everyone just to give a bit of a review update so that we can refresh where we are, if that's in agreement with everyone.
Everybody happy with that? Thank you very much. Thank you. Before we draw our curtains to a close, I must just want to thank the 3 departments of the County Council who are represented here today. Since March, they've been working their socks off to provide a good service for the population of Gloucestershire. Thank you all very much. Sarah, Margaret and Wayne, you've all presided over a tremendous team who've been providing benefits on a daily basis. Thank you. I think we can all have our lunches now. And you can have what you want,
Very kind of you, Stephen. Thank you. Much appreciated.
You can have what you want. Just choose what you want and it's available.
Thank you.
Thank you very much indeed. Thanks.
The meeting is now ended. Thank you.